Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Trimethaphan. Trimethaphan is actually a ganglionic blocker. So it will block the nicotinic receptors. This trimethaphan is an ultra short acting ganglion blocker. That is, the half life of trimethaphan is just 1 hour. So it is used to produce, so occasionally it is used to produce controlled hypotension, and then it is used to produce controlled hypotension. So what is controlled hypotension? In certain surgeries we need to produce controlled hypotension. That is, in certain surgeries, due to some reasons, we will have to decrease the blood pressure below the normal so that the blood loss will decrease and surgery can be done properly. So this controlled hypotension is produced voluntarily by the doctor. So for that we use this drug trimethaphan. So this trimethaphan is used to produce controlled hypotension, which is seen in aortic dissection surgeries. Actually, in aortic dissection surgeries, this controlled hypotension is produced with trimethophan, along with esmolol can also be used for the production of this controlled hypotension.
thank you and thank you for watching.